hip. So you're gonna gently grasp underneath, have them fall back, and then relax into that position. I'll give them further instructions once that they are there. Okay. Perfect. Yep. And so I usually will catch them. So, yep. So you're gonna bring your left hip up. You're gonna fall back. Lovely. All right. Very good. Okay. So we do a couple things. So. In the case of this, you have like 135 hip flexion, and certainly it looks like you have at least that on the left. It's fine to pull your knee up. Most individuals, myself included, is if I pull that past 90, then and there's, I think, an IJSPT article that describes this, is that this will give you an artificial false positive, right? Because their pelvis will posteriorly tip. And thus this leg won't fall to neutral, or if it does, again, it's still a false positive because it will be slightly high, the femur will be slightly higher than it otherwise would be. So I eyeball this, certainly you can measure it, but it's gonna be a vertical plumb line with the femur. The second thing I do, my hand placement is the same. Thumb on ASIS, finger wrapped around the iliac crest. And then one of the modifications that I do is I tell them to gently flatten the back. Similar to the stabilization that they do with the other leg, with the first assessment, is that it just helps to gently stabilize the pelvis. Am I stabilizing the pelvis myself? No. My thumb is actually just under the ASIS, and I'm looking for movement of the ASIS, that bony prominence, relative to my stable thumb, as we gently drop the hip down into extension. And then I will continue to encourage them to just give me the full weight of the limb as you maintain that kind of neutral spine flat against the table. And then I would say right about there is where the ASIS moves just distal and then under my thumb. And so I will then use the clinometer app that I mentioned a moment ago. The corner of the phone goes just under the ASIS. Yes, if someone has like Quadzilla, you will have a slight like artificial reading of that, but then you can usually push into that soft tissue to get into a closer and more accurate measurement. In this case, we are looking at, the GONI says, or the app says 85, which now 84. And so I interpret that as 6 degrees beyond the parallel. And then the app, for those that, I'll turn around in a moment, is you can just spin it. So instead of if you don't want to do math, right, it will just give you the number.